Finally, I'll give you a little story of inspiration from one patient who tried to fight back. And again, it is not going to be easy, but the more people who take action and feel empowered to do so with their physician's help, I think it's a natural alliance. We're kind of on the same side. There's one patient whose story you can read named Kathleen Williams. She's from Cincinnati, and she was in a minor bike crash. She was on this bike trail outside of Cincinnati, and someone said, oh, should we call an ambulance? And she thought she might have broken her arm, which it turned out she did. And not thinking very much, she said, sure, I guess so, because her other option was to call her husband on a cell phone. And so the ambulance arrived. It was from the county fire department. She got in the ambulance, got taken to the hospital where she indeed had an arm fracture. The hospital was covered by her insurance because it was in network, but the ambulance was out of network and charged her $1,200. And she said, wait, this is not right. This is the county fire department that's taking me there. And of course, what many of you may have discovered is fire departments put out fires for free, but they make money doing ambulance transports, and they bill. And P.S., more and more, because, again, the fire department is good guys, but they've mostly outsourced the billing to business people now who say, you can make more money if you're out of network, right? So they then go out of the insurance network. And Kathleen was pretty incensed because she has Humana, which is the major insurer in Cincinnati. So she's like, wait, the fire department, my fire department that my taxes support doesn't support the ambulance. My insurance, which is the bigger insurer in Cincinnati, doesn't support my ambulance ride. So she tried to bargain, and she went to the ambulance company and said, okay, I'll pay you $500. And they said, no. Now, I think everyone should try and bargain, because I've heard so many stories, and this is, again, a terrible position to put patients in, but I have heard many stories of people who went to a hospital, had a cardiac catheterization, and I hear from all the rebellious patients, but what I learned from them is that being rebellious works. Had a cardiac cath, was billed $20,000, went into the business office after he was discharged and said, I'll give you $6,000. And they said, okay, we'll take it. And it's terrible to put people in this position, but I hear this over and over again. Another woman in the book had an air ambulance transport, billed $45,000, said, I only have 15, I'll take it. So and this huge divide between the notional bill charges, the list prices, and what people actually pay and what insurers actually pay is one of the primary ills of our system. But until that's dealt with, until we have a list price, as they do in France, where you go to a doctor's office and there are prices on the wall, we have to deal with this system, and hospitals don't expect to get those $11,000 for their colonoscopy. Now, if you ask a hospital, well, then why did they list it? They'll say, well, because sometimes someone comes in with a suitcase full of cash and we do get it. Or they'll say it creates a bargaining position for us, because then it looks like we're getting, we're being reasonable. But anyway, so back to Kathleen Williams. So they wouldn't take her $500. And as many of you probably have experienced, the default is either you have to pay it or we're going to send you to collections, or we will let you set up a payment plan. So Kathleen brilliantly said, fine, I want to set up a payment plan. She is now paying the ambulance company $10 a month for the rest of her life. As she said, it was the only thing I could do to get back at them. But anyway, it's funny, but also sad. So thank you for having me here, and I look forward to questions and discussion.